Hi, my name is Elsa. I'm one of the nurses taking care of Ebony. We will be doing the post-fall huddle. This is Ebony, our patient. She is an 86-year-old female. She was admitted from home. She's been having some syncopal episodes that have been causing her to fall. She is here for a cardiac workup to determine why she's having syncope. She'll be joining us on our post-fall huddle. We will also be joined by Jane, the unit manager, Kathy, the social worker, Juliet, the CNA, and Laura, the therapy director, which is responsible for both PT and OT. The first thing that we will be reviewing is the fall scale. We will be using the Morse fall scale. Ebony does have a history of falls, so she scored a 25. She does have secondary diagnoses such as diabetes, and she will be scoring a 15. Ebony also uses assistive devices for ambulation. She uses a cane, so her score for that is another 15. She is on continuous IV fluids, so she will be scoring a 20 for that one. She does have a normal gait, so she will be scoring 0 for that. And she is oriented and knows her ability, so she will score a 0. Her total score is a 75, which puts her at high risk. Anything above 51 needs a high-risk fall prevention and interventions placed. I am Ebony's nurse. We will be reviewing different things that we will be implementing for Ebony to reduce the risks of her fall and what we do after falls. So I contacted the provider, letting him know that she did have an unwitness fall and she did have some trauma to her head, and she was noted to be bleeding. I also contacted her family just to let them know. We initiated neuro checks. We'll be doing routine vitals as well as making sure that her blood sugar is stable. I will also be doing a skin assessment and any wound care that needs to be done. The CNA will also be making sure that her bed is in the lowest position, that Ebony has non-skid socks on at all times, because we did notice that her socks were at the bedside nightstand upon entering. We're also going to put Ebony on a toileting program just to make sure that her toileting needs are being met, so she's not waiting for an extensive period of time to be toileted. As well as reviewing not just with Juliet, but with all the CNAs and all the nurses and everyone on the floor, that everyone should be answering call bells. It is everyone's responsibility because they're all of our patients. So we need to ensure that all the patients are being taken care of and safe. The social worker will be informing the family and making sure that anything that is recommended is carried on upon discharge and implemented on that end. Laura, she's the therapy director. We will be asking for both PT and OT reevaluation just to make sure if there's anything else that we can do, such as not using a cane. Maybe a walker would be ideal for her until she has better control of her syncope and we can find out what's causing it, as well as seeing if she might need to be a one assist during her stay here or until we can get the results of her cardiac workup. The unit manager will be just implementing and making sure that all these things are being implemented, care plans are being completed, as well as notifying upper management. And then the CNA, Juliet, and all of us we'll just make sure that we can take care of Ebony as best as possible while she is here and to prevent any further falls from acquiring.